So we have previously learned about how conducting research is very expensive. Program evaluations are very expensive. So this chapter provides us with an alternative to more expensive program evaluations or research studies, because you may be wondering, okay, so as a social worker, I'm not a researcher. It may be difficult for me to obtain those large grants to be able to conduct expensive evaluations or research studies. So this will again provide us an alternative to conducting individual practice evaluation. There are different ways about how we can get feedback about how our services are being effective or not with our clients. One of them could be through our supervisor feedback, and they can provide us with ways on how we can improve our practice. But one of the disadvantages is that their feedback could be more subjective, and we may not be totally candid about discussing our interventions with our supervisor, because they also do conduct our performance evaluation. So we may be afraid of any repercussions on our performance evaluation. So that could be a drawback. We can also get consumer feedback from our clients, but this is usually biased because one, it could be biased in a positive way because again, there are clients, they may be afraid of being candid with us and disappointing us by letting us know that maybe, the intervention is not working for them. Or it can also be biased negatively in that, for example, if we have clients that have been forced to seek our services, they may be very unhappy with our services and the interventions that we are providing. So it may be, again, biased in that way. So, just a moment. So let me launch a question here. Can you see it? A polling question?
Yeah.
Okay. So can you read it, please? Or I can read it and then you can respond. A medical social worker wants her staff to evaluate their practice for an upcoming audit. She's not sure what research design might work best. She decides to do a pilot with one social worker and asks him to assess his practice with one of his clients. So which one would that be? Pre-test design, post-test, single system design, or experimental design? And again, you can just guess, that's okay. Okay. All right. Well, thank you so much. Okay, so those are the results. Okay, so before we go on to single system evaluation, so another way of getting a report from your clients is not just getting their opinion, but asking them to do maybe like a survey based on a scale, and asking them to report on their client, on their own behavior, as opposed to you personally as a therapist. But again, that still has some bias. So today, again, we're gonna be learning about this type, that the polling question was related to single system evaluations, and that's what we're gonna be learning about today. So what the social worker and the prompt was asking, what the supervisor was asking the social worker to do is called a single system evaluation. So a single system evaluation is conducted by individual practitioners, like you will be, and not necessarily researchers. It is called a single system design because you will be focusing on evaluating the outcome of the client, of one single client. So again, it is not costly, and you will be able to do it as an individual. You don't have to be a researcher. I will be discussing a little bit more about single system evaluation. But in research 2, which you will be taking next year, you will be learning how to conduct a single system evaluation. In research 1, I'm gonna be giving you the information so that you're aware of it. And if you want, you can also propose using a single system evaluation for your research proposal, but you don't have to actually conduct the research. But in research 2, you will have the opportunity of doing a single system evaluation with one of your clients that you will have at that time. And they will walk you through the process of doing this type of evaluation. So like other types of research or evaluation, there are different designs that you can use. So again, before we go on, so when are single system evaluations appropriate and when are they not appropriate? So single system evaluations, they're appropriate because in the situations, again, when you can use it to monitor and evaluate participants' responses to the interventions that you are providing to them. And you can use this strategy to study one participant at a time. Again, it is different from other methodologies because you're just studying one client at a time. So, and through this, you are ensuring that your intervention is having a positive effect. And if not, you can revise your intervention to make sure that it is working. It is not appropriate to use if progress cannot be measured and when measurement over time is not possible or when the intervention is very complex. So those are some examples of when it would not be appropriate. So these are the elements of a single system design study. So again, similar to other designs, you have a dependent variable. A dependent variable is basically the behavior that you're targeting for change. So in this case, it would be, for example, reduction in using heroin or substance abuse. So again, it is any type of problem that you want to reduce in your clients. So if it is a behavioral problem or anything that you want to change in your client, any behavior that you want to change. So measuring the dependent variable, there are different ways of measuring this dependent variable or outcome. It can be through frequency. So for example, if you want to measure the number of times that an inpatient psychiatric patient attends recreational therapy each week, so that would be frequency, like how many times does a patient attend recreational therapy. Duration, so if you want to measure the length of time that family members spend eating together over a 2-month period, that's duration. Interval, if you want to measure the length of time between incidents of racial conflict within the community over a period of 5 years, so that would be interval, like the length of time between incidents. Magnitude, the intensity of a client's clinical depression each week as measured by a depression inventory. And presence or absence. So for example, if you wanna record whether an adolescent attends school on time each week, that would be presence or absence. And independent variable, that would be the intervention or the absence of the intervention. So again, the dependent variable, that would be the outcome that you're expecting from the intervention or the lack of intervention. So conducting, so there's a first phase in these type of designs, and this is called a baseline phase. So this is basically the measurements that you will be taking of the behavior as it occurs naturally. So this would be before the intervention. So again, these are measurements taken in the absence of the intervention. So that would be the baseline phase or the A phase. And then conducting intervention phase, or this is what it's called B phase. So these would be the measurements that you would be taking while the client is receiving the intervention. And you can graph. Again, you won't be learning how to do this in this class, but in research 2, you will be learning how to analyze and graph the data from a single systems design. So again, this is an example about drinking. So the baseline, that's the measures that were taken before the intervention and treatment. Those are the measures that were taken during the intervention. So the graph helps you see if there was a reduction in drinking or not. And if there wasn't a reduction, this kind of evaluation then would help you decide whether you wanna try the intervention with your client for a longer period of time and then measure again to see if there was a reduction in drinking, or if you wanna try another intervention that might work better for your client. And these are the type of designs that you can use. So B design is basically a design without a baseline phase. So you would basically just be measuring the outcome while you're implementing the intervention at the same time. And you're recording repeated measures while the treatment is taking place. A-B design. So this is comprised of phase A, again, so the baseline, so you take the measurements. So for example, if your client is drinking a lot, you would ask them to record, like, how many drinks are you taking per day? So you're asking them to record for a specific number of days. And once you start the intervention, you would ask them to do the same, to self-record, like how many drinks are they taking per day. And that would help you to see if there's a change after the treatment or not. Unfortunately, one of the drawbacks of this design would be that you wouldn't know if there are other factors that are taking place that are also modifying your client's behavior, or if it's specifically your intervention that is helping reduce the drinking, for example. So successive intervention. So basically this type of intervention, it's, so again, you also take the measurements during the baseline, and again, during treatment 1, and then you change to another treatment, and you also take the measurements again to see if there's a change again in behavior. And this one is withdrawal design, or ABA. And basically what you do here is, again, you take the measurements and baseline, and then the treatment is introduced and then removed in order to see whether the treatment is having a positive impact on your client's behavior. So again, it helps you see to see if there are other variables that may be causing the change in behavior. So again, this is again the initial behavior. So you have a baseline, then you measure again to see if the intervention is having an effect, and then you withdraw it again where it says baseline to see again if there was an impact, and then you provide the intervention again. However, one of the negative or drawbacks of this is that if, for example, you cannot remove your treatment on clients on certain clients, because for example, so if it may be harmful for them. So if your client is suicidal and you withdraw the treatment, that would be unethical. So again, you would use a design that would be appropriate for your client, taking into consideration that it may be unethical in certain situations to put them at risk. So in this one, in some sense, so this is a little bit backwards compared to the other ones, backwards in the sense that you start off with a treatment followed by a baseline, and then back again with a treatment. So why would you do this? Why would you start with a treatment right away instead of starting with a baseline? The reason would be if, for example, again, if you have a client who has like a very severe or disturbing behavior. So again, if your client is suicidal, when they come to you, you wouldn't start with a baseline with no intervention. You would start right away with an intervention to help them. And once maybe they're stable, you can go to no intervention to be able to get a measurement on whether the treatment is having an impact or not. So with this kind of treatment, it's called multiple baseline design. It's similar to the one that I showed earlier. It is called ABC because you introduce, well, again, you have the baseline, you introduce a treatment. The client could go back to the baseline, and then you could introduce another treatment so that, for example, if you see that a treatment, so if you're providing therapy and you see that the therapy is having no effect on your client, you may change the type of therapy that you're providing to them. So again, so you may go, from talk therapy to CBT therapy, for example. Hold on, let me do another polling. So again, these are just some polling questions to see, can you see them? The polling questions, okay. So take a few minutes to see if, I know that it is a little bit difficult to understand. So that's okay if you don't get it right this first time. These are some practice questions from the quizzes to see if you understand the different designs of single system. Oh, sorry, did it go away? The polling question, it's still there? Okay. Okay. So for the first one, it would be the correct answer is ABA because it says that you're starting without an intervention. So that would be the baseline. Baseline is A. So that's A. And then you implement an intervention. That's B. And then again, you took it away. So that's baseline again. So it's ABA. So again, it's baseline, intervention, baseline. I know that it's confusing because I think with baseline, you would think that baseline is B, but actually baseline is A, B is the intervention, and A is baseline again. And for number 2, the correct answer is ABC because again, so you take the baseline measurement, that's A, and find that the student skill set, okay. You know what? I think it was my fault because I didn't include like the entire prompt. So I see why I think a lot of people got it wrong. It should have been ABC because the question should have said, you take a baseline measurement, you provide an intervention and find that the student skills are lacking. And you begin your intervention at that time. So again, it was my fault. It should have been ABC because it should have been baseline. You provide an intervention and then you provide another intervention. So we have a little bit of time. So what I'm gonna do is, and this is just our last activity before we go. So I'm sharing right now a single subject research handout, which it has like a description or a summary of the different designs, and also your PowerPoint has a summary that you can go back to. Hold on, I want to stop the recording.